Question 1. A 28-year-old male is brought to the emergency department after a high-speed motor vehicle collision. He is confused, has unequal pupils, and a Glasgow Coma Scale, GCS, score of 7. Which intervention is the priority? A. Administer mannitol. B. Prepare for endotracheal intubation. C. Obtain a CT scan of the head. D. Insert a Foley catheter. Correct answer, B. Rationale. A GCS score less than or equal to 8 indicates severe traumatic brain injury and inability to protect the airway. Airway management is the top priority before diagnostics or medications. Strategy. GCS less than or equal to 8 intubate. Airway always comes first in trauma. Question 2. A patient arrives after a stabbing to the left chest. Breath sounds are absent on the left, the trachea is deviated to the right, and blood pressure is rapidly dropping. What is the priority intervention? A. Obtain a chest X-ray. B. Administer 4 fluids. C. Perform needle decompression. D. Prepare for intubation. Correct answer, C. Rationale. These findings indicate tension pneumothorax, a life-threatening condition requiring immediate needle decompression before imaging or intubation. Strategy. Absent breath sounds plus tracheal deviation equals decompress now. Question 3. A trauma patient with pelvic fractures is hypotensive despite fluid resuscitation. Which complication is the nurse most concerned about? A. Pulmonary embolism. B. Neurogenic shock. C. Hemorrhagic shock. D. Fat embolism syndrome. Correct answer, C. Rationale. Pelvic fractures can hide massive internal bleeding, making hemorrhagic shock the most immediate life-threatening risk. Strategy. Pelvis equals blood loss until proven otherwise. Question 4. A client with blunt abdominal trauma presents with abdominal distension, guarding, and a falling blood pressure. Which action is priority? A. Administer pain medication. B. Prepare for emergency laparotomy. C. Insert nasogastric tube. D. Obtain abdominal ultrasound. Correct answer, B. Rationale. Signs indicate internal bleeding and peritonitis. The unstable patient requires immediate surgical intervention, not diagnostics. Strategy. Unstable plus bleeding signs equals or not tests. Question 5. A motorcycle crash victim has paradoxical chest wall movement and severe respiratory distress. What condition does the nurse suspect? A. Hemothorax. B. A pulmonary contusion. C. Flail chest. D. Simple pneumothorax. Correct answer, C. Rationale. Paradoxical chest movement is the hallmark of flail chest, causing impaired ventilation and hypoxia. Strategy. Paradoxical movement equals flail chest. Question 6. A trauma patient suddenly becomes restless, tachycardic, and hypoxic 24 hours after a long bone fracture. What is the most likely diagnosis? A. Tension pneumothorax. B. Fat embolism syndrome. C. A pulmonary embolism. D. Acute respiratory distress syndrome. Correct answer, B. Rationale.
Fat embolism syndrome commonly occurs 24 to 72 hours after long bone fractures, presenting with hypoxia, confusion, and tachycardia.
Strategy. Long bone plus 24 to 72 hours plus hypoxia equals fat embolism. Question 7. A client with a spinal cord injury at T6 suddenly develops severe hypertension, bradycardia, flushing above the injury level, and pounding headache. What is the priority nursing action? A. Administer 4 antihypertensive medication. B. Place the client in Trendelenburg position. C. Check for bladder distension. D. Apply supplemental oxygen. Correct answer, C. Rationale. This is autonomic dysreflexia, most commonly triggered by bladder distension. Question 8. A trauma patient presents with hypotension, warm dry skin, and bradycardia after a cervical spine injury. Which type of shock is suspected? A. Hypovolemic shock. B. Septic shock. C. Cardiogenic shock. D. Neurogenic shock. Correct answer, D. Rationale. Loss of sympathetic tone from spinal cord injury causes neurogenic shock, characterized by hypotension and bradycardia with warm skin. Strategy. Spinal injury plus hypotension plus bradycardia equals neurogenic shock. Question 9. A patient with severe burns to the chest and neck develops hoarseness and soot around the mouth. What is the priority intervention? A. Administer 4 opioids. B. Obtain arterial blood gases. C. Prepare for early intubation. D. Apply cool compresses. Correct answer, C. Rationale. Signs of inhalation injury indicate impending airway obstruction. Early intubation prevents complete airway closure. Strategy. Burn plus hoarseness equals secure airway now. Question 10. A trauma patient suddenly becomes hypotensive, has muffled heart sounds, and jugular venous distension. Which condition is suspected? A. Tension pneumothorax. B. Cardiac tamponade. C. Massive hemothorax. D. Pulmonary embolism. Correct answer, B. Rationale. This is Beck's triad, classic for cardiac tamponade, a life-threatening emergency requiring immediate intervention. Strategy. Muffled sounds plus JVD plus hypotension equals tamponade. Question 11. A client with severe head trauma develops increased urine output and low urine-specific gravity. Which complication does the nurse suspect? A. SIAD. B. Acute kidney injury. C. Diabetes insipidus. D. Cerebral edema. Correct answer, C. Rationale. Head trauma can damage the pituitary, leading to diabetes insipidus, causing excessive dilute urine output. Strategy. Head injury plus high urine output equals DI. Question 12. A patient with abdominal trauma has shoulder pain and signs of internal bleeding. Which organ injury is most likely? A. Liver. B. Kidney. C. Spleen. D. Pancreas. Correct answer, C. Rationale. Referred left shoulder pain, care sign, indicates splenic injury with intra-abdominal bleeding. Strategy. Left shoulder pain after trauma equals spleen. Question 13.
A trauma patient arrives with profuse bleeding from a deep thigh wound.
Bright red blood is spurting with each heartbeat. What is the priority nursing action? A. Apply direct pressure. B. Apply a tourniquet proximal to the wound. C. Elevate the affected limb. D. Start large bore for access. Correct answer, B. Rationale.
Pulsatile, bright red bleeding indicates arterial hemorrhage.
Immediate application of a tourniquet is required to control life-threatening blood loss. Strategy. Spurting blood equals artery tourniquet now. Question 14. A patient involved in a house fire presents with headache, dizziness, and nausea. Pulse oximetry reads 99%. What finding best confirms the suspected diagnosis? A. Chest X-ray showing infiltrates. B. Elevated carboxyhemoglobin level. C. Low arterial oxygen level. D. Elevated serum lactate. Correct answer, B. Rationale. Carbon monoxide poisoning presents with normal SpO2 but elevated carboxyhemoglobin levels, which confirm the diagnosis. Strategy. Normal SpO2 plus fire exposure equals check CO level. Question 15. A client with traumatic brain injury shows worsening headache, vomiting, and decreasing level of consciousness. Which complication is suspected? A. Cerebral perfusion improvement. B. Increased intracranial pressure. C. Acute delirium. D. Post-concussion syndrome. Correct answer, B. Rationale. These are classic signs of increased intracranial pressure, ICP, a life-threatening complication after head trauma. Strategy. Vomiting plus LOC after head injury equals ICP. Question 16. A trauma patient suddenly develops sharp chest pain, dyspnea, and hypotension shortly after central line insertion. What is the most likely cause? A. Cardiac tamponade. B. A pulmonary embolism. C. Tension pneumothorax. D. A acute myocardial infarction. Correct answer, C. Rationale. Central line placement can puncture the lung, leading to tension pneumothorax, causing sudden respiratory distress and hypotension. Strategy. Sudden distress after line insertion equals tension pneumothorax. Question 17. A patient with severe hemorrhage receives massive blood transfusion. Which electrolyte imbalance is the nurse most concerned about? A. Hyperkalemia. B. A hypocalcemia. C. Hypernatremia. D. Hypomagnesemia. Correct answer, B. Rationale. Citrate in stored blood binds calcium, leading to hypocalcemia, which can cause dysrhythmias and hypotension. Strategy. Massive transfusion low calcium. Question 18. A trauma patient with chest injury has decreased breath sounds and dullness to percussion on one side. Which condition is suspected? A. Simple pneumothorax. B. Tension pneumothorax. C. Hemothorax. D. A pulmonary contusion. Correct answer, C. Rationale. Dullness to percussion and decreased breath sounds indicate blood in the pleural space, consistent with hemothorax. Strategy. Dull percussion equals fluid, blood. Question 19. A patient with blunt chest trauma presents with chest pain, dyspnea, and crackles on auscultation. Chest X-ray shows alveolar infiltrates. Which injury is most likely? A. A flail chest. B. A pulmonary contusion. C. Hemothorax. D. Simple pneumothorax. Correct answer, B. Rationale.
Pulmonary contusion causes alveolar bleeding and edema, leading to crackles and infiltrates on imaging.
Strategy. Crackles plus trauma plus infiltrates equals pulmonary contusion. Question 20. A trauma patient is hypotensive, tachycardic, and has delayed capillary refill. Which intervention should the nurse initiate first? A. Administer vasopressors. B. Insert urinary catheter. C. Begin rapid fluid resuscitation. D. Obtain blood for laboratory studies. Correct answer, C. Rationale. These are signs of hypovolemic shock. Immediate fluid resuscitation is essential before diagnostics or medications. Strategy. Shock signs fluids first. Question 21. A patient with a basilar skull fracture presents with clear fluid draining from the nose. Which action is most appropriate? A. Insert a nasogastric tube. B. Test the fluid for glucose. C. Pack the nose with gauze. D. Apply continuous suction. Correct answer, B. Rationale. Clear drainage may be cerebrospinal fluid, CSF. Testing for glucose helps confirm CSF leak. NG tube insertion is contraindicated. Strategy. Clear drainage plus head trauma equals check for CSF. Question 22. A trauma patient with crush injury develops dark urine, muscle pain, and elevated creatine kinase levels. What complication is suspected? A. Acute glomerulonephritis. B. Hemolytic anemia. C. Rhabdomyolysis. D. Compartment syndrome. Correct answer, C. Rationale. Muscle breakdown releases myoglobin, leading to rhabdomyolysis, which can cause acute kidney injury. Strategy. Crush injury plus dark urine equals rhabdo. Question 23. A patient with multiple injuries suddenly becomes confused, hypotensive, and has petechiae on the chest. Which diagnosis is most likely? A. Septic shock. B. Fat embolism syndrome. C. Acute respiratory failure. D. Disseminated intravascular coagulation. Correct answer, B. Rationale. Fat embolism syndrome presents with respiratory distress, neurological changes, and petechial rash after trauma. Strategy. Triad, lungs plus brain plus petechiae equals fat embolism. Question 24. A trauma patient complains of severe leg pain unrelieved by opioids. The limb is tense and swollen. What is the priority nursing action? I. Apply cold compress. B. Elevate the limb above heart level. C. Notify the provider immediately. D. Encourage range of motion exercises. Correct answer, C. Rationale.
These are classic signs of compartment syndrome, a surgical emergency requiring immediate fasciotomy.
Strategy. Pain out of proportion equals compartment syndrome. Question 25. A patient with suspected cervical spine injury is vomiting and becoming increasingly drowsy. What is the priority action? A. Administer antiemetics. B. Log roll the patient. C. Maintain cervical spine immobilization. D. Insert nasogastric tube. Correct answer, C. Rationale. Cervical spine injury must be assumed and protected until ruled out to prevent secondary spinal cord damage. Strategy. Trauma plus altered LOC equals protect the spine. Question 26. A trauma patient with abdominal injury becomes hypotensive and tachycardic. Fast scan is positive. What is the next priority action? A. Continue monitoring vital signs. B. Obtain CT scan of the abdomen. C. Prepare for emergency surgery. D. Administer oral fluids. Correct answer, C. Rationale. A positive FAST with hemodynamic instability indicates internal bleeding requiring immediate surgical intervention. Strategy. Unstable plus FAST positive equals or now. Question 27. A client with a cervical spine injury suddenly experiences respiratory distress and inability to move the arms. What complication is suspected? A. Spinal shock. B. Autonomic dysreflexia. C. Neurogenic shock. D. Phrenic nerve injury. Correct answer, D. Rationale. High cervical injuries, C3-C5, can damage the phrenic nerve, leading to diaphragmatic paralysis and respiratory failure. Strategy. C3-C5 injury equals diaphragm risk. Question 28. A trauma patient develops metabolic acidosis, hypothermia, and coagulopathy. This combination is known as A. Shock cascade. B. Lethal triad. C. Systemic inflammatory response. D. Multiple organ dysfunction syndrome. Correct answer, B. Rationale. The lethal triad, hypothermia, acidosis, coagulopathy, significantly increases mortality in trauma patients. Strategy. Cold plus acid plus bleed equals lethal triad. Question 29. A patient with suspected internal bleeding has decreasing urine output. What does this finding most directly indicate? A. Renal failure. B. A fluid overload. C. Decreased renal perfusion. D. Bladder obstruction. Correct answer, C. Rationale. Low urine output in trauma indicates poor perfusion, often due to hypovolemia or shock. Strategy. Urine output equals perfusion marker. Question 30. A trauma patient with head injury exhibits Cushing's triad. Which assessment finding completes the triad? A. Tachycardia. B. Hypotension. C. Bradycardia. D. Fever. Correct answer, C. Rationale. Cushing's triad includes hypertension, bradycardia, and irregular respirations,
indicating increased ICP.
Strategy. BP plus HR equals ICP. Question 31. A patient with an open fracture is at greatest risk for which complication? A. Osteoporosis. B. Osteomyelitis. C. Fat embolism. D. Joint dislocation. Correct answer, B. Rationale. Open fractures expose bone to pathogens, greatly increasing risk for osteomyelitis. Strategy. Open bone equals infection risk. Question 32. A trauma patient becomes hypotensive after removal of a pelvic binder. What is the most likely cause? A. Neurogenic shock. B. Increased intracranial pressure. C. Recurrent pelvic bleeding. D. Acute renal failure. Correct answer, C. Rationale. Pelvic binders stabilize fractures and reduce bleeding. Removing it prematurely can cause recurrent hemorrhage. Strategy. Pelvic binder off, bleeding back. Question 33. A patient with suspected inhalation injury has cherry red skin discoloration. Which gas is responsible? A. Carbon dioxide. B. Cyanide. C. Carbon monoxide. D. Nitrogen. Correct answer, C. Rationale. Carbon monoxide binds hemoglobin, causing tissue hypoxia and cherry red appearance, rare but classic. Strategy. Fire plus cherry red equals CO. Question 34. A trauma patient with multiple long bone fractures develops hypoxia and altered mental status. What is the priority intervention? A. Administer anticoagulants. B. Provide high-flow oxygen. C. Prepare for intubation. D. Restrict fluids. Correct answer, B. Rationale. This presentation suggests fat embolism syndrome. Immediate oxygen therapy is the first priority. Strategy. Fat embolism, oxygen first. Question 35. A trauma patient with severe blood loss develops oozing from 4 sites and gums. Which condition is suspected? A. Thrombocytopenia. B. Hemophilia. C. Disseminated intravascular coagulation. D. Acute liver failure. Correct answer, C. Rationale. DIC causes widespread clotting and bleeding, leading to oozing from puncture sites in trauma patients. Strategy. Bleeding everywhere equals DIC. Question 36. A trauma patient with severe hemorrhage remains hypotensive despite fluid resuscitation. Which medication should the nurse anticipate? A. Dopamine. B. Norepinephrine. C. Epinephrine. D. Phenylephrine. Correct answer, B. Rationale. Norepinephrine is the vasopressor of choice for persistent hypotension after adequate volume resuscitation. Strategy. Fluids first, then norepinephrine. Question 37. A patient with blunt abdominal trauma has left lower rib fractures. Which organ injury is the nurse most concerned about? A. Liver. B. Kidney. C. Spleen. D. Pancreas. Correct answer, C. Rationale. Left lower rib fractures commonly injure the spleen, leading to life-threatening hemorrhage. Strategy. Left ribs equals spleen. Question 38. A trauma patient suddenly becomes unresponsive during intubation. The monitor shows pulseless electrical activity, PA. What is the priority intervention? A. Administer epinephrine.
B. Begin chest compressions.
C. Defibrillate immediately. D. Secure the airway. Correct answer, B. Rationale. PEA is a non-shockable rhythm. Immediate high-quality CPR is the priority. Strategy. No pulse equals compressions first. Question 39. A patient with severe head injury develops posturing, unequal pupils, and bradycardia. Which intervention is most urgent? A. Elevate the head of the bed. B. Administer hypertonic saline. C. Obtain repeat CT scan. D. Perform neurological assessment. Correct answer, B. Rationale.
These signs indicate impending brain herniation.
Hypertonic saline rapidly reduces intracranial pressure. Strategy. Herniation signs osmotic therapy now. Question 40. A trauma patient with burns covering 45% of total body surface area is in the first 24 hours post-injury. Which fluid is most appropriate? A. Dextrose 5% in water. B. 0.45% normal saline. C. Lactated ringers. D. Albumin. Correct answer, C. Rationale. Lactated ringers is the preferred fluid for burn resuscitation during the first 24 hours. Strategy. Early burns equals LR. Question 41. A patient with suspected bowel perforation reports sudden severe abdominal pain followed by relief. What does this indicate? A. Healing process. B. Pain medication effect. C. Nerve damage. D. Peritonitis. Correct answer, D. Rationale. Sudden pain relief occurs when nerve endings are destroyed, signaling peritonitis, a surgical emergency. Strategy. Pain sudden relief equals danger. Question 42. A trauma patient presents with hypotension, tachycardia, and flat neck veins. Which condition is most likely? A. Cardiac tamponade. B. Tension pneumothorax. C. A hypovolemic shock. D. Neurogenic shock. Correct answer, C. Rationale. Flat neck veins indicate volume loss, consistent with hypovolemic shock. Strategy. Flat veins equals empty tank. Question 43. A patient with crush injury is at highest risk for which life-threatening electrolyte imbalance? A. Hypokalemia. B. Hyperkalemia. C. A hypocalcemia. D. Hypernatremia. Correct answer, B. Rationale. Cellular destruction releases potassium, causing hyperkalemia, which can lead to fatal dysrhythmias. Strategy. Crush injury high K. Question 44. A trauma patient with suspected esophageal rupture complains of severe chest pain after vomiting. What is the priority nursing action? A. Insert nasogastric tube. B. Administer antiemetics. C. Keep the patient NPO. D. Obtain oral contrast study. Correct answer, C. Rationale. Esophageal rupture is a medical emergency. Keeping the patient NPO prevents further contamination. Strategy. Rupture suspicion equals NPO immediately. Question 45. A trauma patient with long bone fractures suddenly develops respiratory distress and altered mental status. What is the best initial diagnostic test? A. Chest X-ray. B. CT angiography. C. Arterial blood gas. D. D-dimer. Correct answer, C. Rationale. ABG rapidly detects hypoxemia, the earliest indicator of fat embolism syndrome. Strategy. Suspected fat embolism ABG first. Question 46. A patient with head trauma has cerebrospinal fluid leaking from the ear. Which action is contraindicated? A. Elevating the head of the bed. B. Testing drainage for glucose. C. Applying a sterile dressing. D. Inserting a nasogastric tube. Correct answer, D. Rationale. Basilar skull fracture increases risk of intracranial placement of NG tube, strictly contraindicated. Strategy. Basilar skull fracture equals NONG/NT. Question 47. A trauma patient develops worsening hypoxia despite oxygen therapy. Breath sounds are equal bilaterally. What is the most likely cause? A. Pulmonary embolism. B. Tension pneumothorax. C. Hemothorax. D. Flail chest. Correct answer, A. Rationale. Equal breath sounds rule out pneumothorax. Sudden hypoxia suggests pulmonary embolism. Strategy. Sudden hypoxia plus equal lungs equals PE. Question 48. A patient with traumatic amputation arrives at the ED. What is the priority nursing action? A. Clean the amputated part. B. Control bleeding. C. Administer pain medication. D. Preserve the amputated limb. Correct answer, B. Rationale. Hemorrhage control is the immediate life-saving priority. Strategy. Life over limb, stop bleeding first. Question 49. A trauma patient with sepsis-like symptoms develops hypotension unresponsive to fluids. Which medication should be started? A. Dobutamine. B. Vasopressin. C. Norepinephrine. D. Nitroglycerin. Correct answer, C. Rationale. Norepinephrine is first line for refractory hypotension in shock states. Strategy. Shock plus fluids fail equals norepinephrine. Question 50. A patient involved in a high-impact collision is alert but complains of increasing abdominal pain. Vital signs are stable. What is the best next action? A. Discharge the patient. B. Administer analgesics only. C. Obtain CT scan of the abdomen. D. Start broad-spectrum antibiotics. Correct answer, C. Rationale. Stable trauma patients with abdominal pain require CT imaging to rule out internal injuries. Strategy. Stable plus abdominal pain equals CT scan.
Thanks for watching. Keep practicing, keep pushing, and keep believing in yourself. Every question you answer brings you one step closer to becoming a confident nurse. Don't forget to like this video, subscribe to MCQs Master 101, turn on notifications for more Nclex case study practice. Comment below, what topic should we cover next? Until next time, study smart, stay focused.